Sarah Young is joining me now from the Intermountain Medical Center Heart Institute, and you do have a big heart-related event, a fair coming up at the hospital this Saturday. Tell me about it.
Great. So it's from 9 to 1 this Saturday at Intermountain Medical Center, and it's all about heart disease. We're going to do screenings to help people understand their risk. We're going to have seminars, demonstrations about how to cook and be heart healthy, and all kinds of great information.
There's so much out there that I think people don't know about heart disease and taking care of your heart. It is February, so tomorrow. So this is a good time to start talking about it. What do people need to know, and what should they be doing with their health that they're not?
Sure. Well, what so many people don't understand is that the majority of heart disease is preventable. So it's the number one cause of death in the United States among men and women.
So both men and women?
Both men and women. But so much of it is preventable. And so before you get sick, if you eat healthy, if you have the right kind of lifestyle, you can avoid a lot of trouble. And if you already do have heart disease, there's still a lot of changes that you can make in your lifestyle that can make a really big difference.
When you talk about screenings, who should be having those, and what happens during the screening?
Sure. So we're going to be screening all the adults who come. The screening starts with questions about your family history, your lifestyle, and then we'll take some measurements, your blood pressure, your weight, to calculate your BMI, and we'll see if you are at risk. And then if you are at risk for heart disease, then you can move on to a free EKG, and you can do that in the same morning.
Sarah, should you be doing those screenings all the time? I mean, is that something maybe once a year you should be doing with your family doctor?
Yes, absolutely. You should be seeing your doctor once a year, because knowing those numbers, your blood pressure, your cholesterol level, those numbers help you decide how to modify your lifestyle, and then that will help you live a longer, healthier life.
Are we doing them? Are people getting screened?
No, not like they should. No, many people put it off until they're much older. But you need to start making these changes when you're younger. You know, in your 30s, you need to know your risks, your blood pressure.
And know your numbers, right? Know your blood pressure, know your BMI, and know these things. You can learn all of that at this event. It is free. We should mention that. That's coming up Saturday.
Yes.
What else is going to be there that people can be part of?
Sure. Well, there's actually great things for the kids. We have a whole kids area, so you can bring your whole family. They have an activity course they can go through and some great giveaways for them. This year, we're actually having some great pets from pet therapy, because owning a pet actually can lower your risk of heart disease. So that's sort of a fun, lighter topic that we'll have at the fair as well.
Well, I know you've seen studies on that before. Is it especially a dog, or is it a cat too?
Well, the dogs do help you be more active.
Well, they're social. Right?
Yeah, but any pet helps reduce that stress and anxiety, and that improves your lifestyle, and then that translates to better heart health. So there's so many connections here.
And that's what you want to do. You want to get heart healthy here at the beginning of February. So many people make New Year's resolutions, and when you say healthy, I think you would say this is a big part of that.
This is a big part of it.
You're talking exercise too?
We are. We're talking about exercise. Not being a weekend warrior, getting that 30 minutes of exercise every day, getting up and down from your desk a couple times an hour, all of those things make a big difference.
Okay, I'm glad you mentioned that. 30 minutes a day, how many days a week?
Most days a week.
Oh, okay. You're like every single one of those.
Yeah.
Okay. That information and so much more that maybe you didn't know. Coming up February 4th from 9 to 1. It's at the Intermountain Heart Institute. That's at the Intermountain Medical Center. All this information is going to be on our website. Go to goodforutah.com/midday. I don't know if people out there knew, too, you are the premier Heart Center, and this is one of the biggest heart fairs in the Intermountain West.
Yeah.
You guys do.
Yeah, we always draw so many people, which is great. People come out in February and they care about their hearts. So.
We're talking about it. Talking about it's good.
Yeah, that's great.
Thank you so much, Sarah. And Brian, back over to you.